Well, more than 20 countries have now reported cases of the Zika virus, and the World Health Organization says it's expected to spread across all of Latin America and the Caribbean. The mosquito-borne illness has been linked to a birth defect that causes an abnormally small head. The CDC is warning pregnant women to avoid travel to countries that have been affected.
So Kristen Bernard, along with Matt Aliota, are here today. Both are with the UW Vet School. Thanks so much for being here.
Sure.
This is such a big talker.
Yeah, this is scary.
Matt, I know that you were part of the team that confirmed the Zika virus in Colombia. So how was that done? How did you go about that?
Sure. So part of a team working with collaborators in Colombia at a field site. So we had some patients that came into the hospital there that were sick with fever. So Zika virus is characterized by very nonspecific symptoms. It overlaps with a number of other different viruses that are also transmitted by mosquitoes. So we suspected originally that they may have dengue virus that's transmitted by the same mosquito that transmits Zika virus. And so we did diagnosis on them and confirmed that they didn't have dengue virus, and then something called chikungunya virus, and what we found was that they had Zika virus.
Is this something new, the Zika virus, or has it been around for a while?
Well, Zika virus has been around for a while. We've known about it since about 1947. It was first isolated in Africa. But there were not a lot of human cases until very recently. So it emerged out of Africa. It's been circulating in Southeast Asia for around 50 years. And then more recently, in 2007, it's expanded its geographic range into the Pacific Islands. And now it's in the Western Hemisphere for the first time, with a number of cases in Brazil. And then Colombia is second only to Brazil in the number of confirmed cases.
And how many countries are we up to now? About 20?
In the Americas, about 20, I think, including the territories.
So pregnant women are told to avoid these areas, but if you're not or not planning to become pregnant, is it a risk to the rest of us?
There's still a risk in that you would have some disease, about 20% chance of getting that disease, a fever, rash, etc. And there is now some reports of Guillain-Barré syndrome, which is a neurologic syndrome. Those are probably very rare, though. So I would think travel, if you're not pregnant or trying to get pregnant, is the risk is much lower.
And if you're concerned, you can always take along mosquito repellent with DEET in it is the best thing.
Okay.
Can you transfer it to, let's say I have it, can I give it to someone else?
No.
Okay.
It's not contagious as much as we know. There are some reports of finding the virus in different secretions, such as saliva, but it's probably very, very, very rare for that to happen.
Okay. So how do you try to stop it? DEET, is that really the answer, or is there more to it than that?
Unfortunately, there's no vaccine. There's no treatment. There's no vaccine to prevent it. There's no antibiotics or drugs that we can give you if you contract the virus. And so the way to control it is to try to control mosquito populations right now. And
yeah, absolutely. It's mosquito control.
Is there a possibility that it could come to this country?
Yes, it is possible. We do have the mosquitoes that are able to transmit this virus. Most of them are in the tropics and tropical areas in Florida and the southern states. But we do have another mosquito that's as far north as Illinois. So it is possible. On the other hand, another virus, dengue, that Matt mentioned, we have not seen that in the United States yet, and it's transmitted by the same mosquitoes, as far as, except for in the very southern states like Florida.
So mosquito repellent is the best.
Mosquito repellent, for sure, for our travelers, is absolutely mosquito repellent.
All right, well, very interesting.
Yeah.
Thanks for coming in. Thanks for the information. We appreciate it.
You're welcome.
Kristen, Matt, thanks again.